Oh, it's counting down again. Hey Tribe, Chelsea here. I am so excited to bring Mona on with us today. She is going to talk to us about her Doctor of Nursing practice with her focus in women's health. I am so excited to learn from you, Mona, and I'm glad that you've given us some time today. You have 14 years of healthcare experience, and you're currently working as a Doctor of Nursing practice primarily with women's health. Is that right?
That's correct.
Okay, we had a little bit of confusion there initially, but I think we've got it now. So you have an amazing passion for educating women about their bodies and empowering them along the way. So I can't wait to learn from you and just get a little bit of what you've got up your sleeve and how you're using your nursing degree. Do you want to introduce yourself? Anything maybe I missed that you want to add?
Yeah, I think I guess I'll kind of just like clarify so that might like help questions that are coming in. So I have my Doctor of Nursing practice. It's like the focus is family nurse practitioner. And then within that, I've worked in largely family practice settings, but have been kind of like one of the go-to providers for the various women's health services. And I would say like at least 70% of my population ends up being women or like women and children, so their families. And then this year, I switched over to just doing my own practice, which is all focused on women's health, holistic health, kind of mindset work, and fertility awareness.
Awesome. We get so many people interested in what field of nursing can I do that's more holistically focused. So I can't wait for you to be able to tap into that a little bit and tell us a little bit about what it is that you're doing to combine those two. Because so many people go into nursing with that mindset that they want to combine those two. And when you're solely in Western medicine, it kind of seems discouraging to some people. So I'm excited to hear your take on that. Hannah asked, what did you do prior to going back to school for your doctorate in women's health? But it's not in women's health, just your doctorate in nursing.
So before I went back to school, I worked a couple of different places. So I went to New Mexico State University and then worked at the Mayo Clinic in Minnesota. And I did blood and marrow transplant for adults. So like basically like end-stage cancer management. For adults. And then I did pediatrics at the Mayo Clinic as well, and then worked in the pediatric intensive care unit with Chelsea in New Mexico. And then kind of like all along knew that I would eventually go back to school, but was trying to kind of like navigate my way through like, do I want to do peds? Do I want to do women's health? Do I want to do family? Do I want to like quit nursing? Because I kind of like had that phase where I was just like hitting burnout. And then like when I was in grad school, I did some research work and global health work.
That's really interesting. I love that path. And I really appreciate the fact that you had that level of, do I want to quit nursing altogether? And then went this route. It's amazing how many opportunities there are in nursing.
Yeah.
And I'm thankful that you didn't give up and now you found your passion here. That's awesome. So Bree asked, how many years experience did you have prior to going back for your master's?
So before going back, let's see, I graduated in 2006 and then started school in 2011. So 5 years.
Okay. And were you working as a nurse throughout your master's program as well?
I decided not to. So I went to school at UW and then I was moving, and then it was like the process of getting a nursing license. And then when I thought about like what orientation looks like, and most places want you to work full time, and I would like at least during orientation, and then be in school full time. And I decided to not do it. And I feel really grateful that I didn't do that. And it also gave me the opportunity to try some different things out, like doing research, and gave me the opportunity to travel. Like I did some stuff in India and in Kenya when I was in grad school. And if I was working, that would have been a lot harder. And you can't switch. What's challenging, I would say, like if you go to grad school in a state that you're not at, is often like getting a PRN position. It's like you can get them, but they usually want you to do like a full-time orientation for like X, like whatever. I think a lot of the ones in Seattle I was looking at was like a month or 2 months or whatever. And I moved up like right before school started. So it just didn't feel worth it to me. And I would say like, also, which this is kind of like a hindsight thing, but also like the provider brain and the nursing brain is so different.
Okay.
That I feel like to me, it really allowed me to just like sink into what it meant to like be a provider, to diagnose. And I felt like, I think that that would have been a little bit challenging, or maybe not challenging, but I just feel like it really allowed me to like lean into the journey of being a provider instead of being a nurse.
That's really good insight. When did you feel like you switched to this passion of women's health? Like, was there some sort of like trigger for you or something that drew you into that field?
I've just always loved women's health. I grew up like largely with a single mom, and we didn't have a lot of money. So like women and children's health has always been my passion. Actually, like before I thought about going back to school, I thought about being a midwife, but I felt like it kind of, and I was like looking into schools and trainings, but I didn't want to be like pigeonholed into only doing pregnancy or right after birth. But yeah, I mean, when I was working at like the Mayo Clinic, I used to volunteer at like women's shelters and like clinics that are within women's shelters. And so I've always loved it, but I think the like responsible, like Capricorn type A personality in me was like, I must make sure that I have opportunities and that I can always get jobs within like a broader training versus if I only do women's health, it can be, which I know those are like some of the questions that are going to come up and we're going to talk about. But my experience and like that of like a lot of women I know that have done more, and men that have done like more specific trainings, like whether it's like pediatrics or women's health or whatever, it can be a lot more challenging to get jobs nowadays with like a more specified degree.
That was the very next question, actually. So that's awesome. Katie asked, what's the difference between a doctorate of women's health, a women's health nurse practitioner, and a CNM, a certified nurse midwife? I don't know if you can just quickly pick apart the differences there.
So a women's health nurse practitioner, so like a certified nurse midwife, you're dealing with pregnancy. And so that is like your sole job is like kind of like the prenatal period through pregnancy and then the postpartum period, versus a women's health nurse practitioner. I kind of would think of it more of like an OB-GYN where you're doing anything GYN related.
Okay.
And then a doctorate is just like that doesn't change what you do. So a women's health nurse practitioner, I don't even honestly know the programs very well because I haven't looked into them, but I would assume there's master's versions and doctorate versions. And so that's just like the educational degree you get with it.
Gotcha. And does it give you more freedom having your doctorate versus your master's in terms of independent care or independent practice, those sorts of things?
Yeah. I mean, like that, like independent practice is still state by state. Mm-hmm. So it doesn't change that. I think, like the medical community as a whole, I would say is for graduate degrees kind of leaning more towards doctorate training, like if you kind of look into that. And so kind of in the research I did and when I would talk to people and at schools and stuff, it seemed like, you know, it's like now if you go to apply for a job and it says like BSN preferred, kind of like the feedback that I get is that like ultimately it'll say DNP preferred instead of MSN preferred. And also it just gives you like a broader base of knowledge of things that you can do. So you're doing like practice improvement if you're interested in doing kind of more like program management type stuff. Okay. And it also has like a heavier research base to it, plus practice. So it's kind of like the tripartite is like what they call it. So it's like 3 different pieces. So it also makes you, I would say, like maybe appear more well-rounded to employers.
Okay, good. Victoria asked, what's the difference between an Fnp curriculum and a PA curriculum?
So PA is based in the medical model and NP curriculum is based in nursing. So kind of like nursing, we all know is like more based on like care of the patient. And then PA is kind of that more traditional medical model. They're really similar, really like undergraduate degree wise, like you have to have a nursing degree to get an NP and you can have any degree really, as long as you meet like the prereqs to be a PA. Kind of like across the board, PAs, you have to work under a physician versus depending on like what state you're in as an NP, you can work independent.
Great explanation. So Paige wants to know, how would you advise master level students to get the most out of their women's health rotation?
Yeah, I mean, I think really just like asking to do as much as you can. So like pap smears, pelvic exams, IUDs, like all of those things are things that become better with practice. So like really, if you have a preceptor that lets you do as much as possible, like I would say always across the board, like jump in and do that. Like really like dive into like the questions about hormones and birth control and life cycles so that you understand those things, because I don't think that that is always super well taught in grad school.
Okay, great. Hannah asked, where can you find a program specific to Doctorate of Women's Health or Women's Health Nurse Practitioner? And maybe you can just really talk about what made you choose UW versus any other program. What were you looking for in these programs?
Yeah, I'm pretty sure UW has a women's health one, or they used to. Honestly, like I wasn't looking specifically for that. So I was looking for Fnp, and I had like an entire spreadsheet, because that's how I do things, where I was looking at like the overall cost of the program, how many clinical hours you get, because clinical hours really change. And I think all of us that are in the medical field and in nursing know, like, you learn on the job. You don't learn like through the textbooks or classes. So like clinical hours, I would really focus on. And then I specifically wanted a doctorate program because I felt like if I'm going back to school, I'm doing it once. I think this is like maybe not going to be an issue until like 20 years from now, but I think it will be. And I was looking at like national rankings. So like US, I think it's like US News and Report, they have national rankings. And UW and like UCSF are always like number 1 or number 2. I'm trying to think. Those are like the main things I remember looking at. Yeah, I would say like anybody that's specifically like interested in like women's health versus like family nurse practitioner, if we don't have time to kind of like dive into that a little bit more, I'm happy to connect with them. But I personally would probably like try and sway you to family, because that is like where I see people wanting to hire. So I don't know.
I think you can specialize. If you have that broad-based degree, then you can specialize in peds, or you can specialize in women's health.
Yeah, because people just want that, because it's like, let's say you work in like a clinic that is like a women's health clinic, but then like the woman's like kid needs to be seen. Like you can still see that kid, but it's like most of what you can do is like, you could like largely focus. That's what I did. Like I was like the only provider that did colposcopies in our office, and I did like most of our IUDs. So it's like, you can definitely make kind of like your little niche in practice, but you're going to have a lot more job opportunities if you have like a bigger degree, just like generally speaking, and more job security, because like, let's say you want to do women's health, but you need to take time to build up that experience. Like, yeah, I think it just is like overall more job security to do family.
Yeah, I completely agree. So Hannah asked, where can you, next question. Mackenzie asked, I'm currently in an accelerated BSN to MSN program planning to specialize in women's health. Any advice to make myself more attractive to a job as a women's health care nurse practitioner when I graduate?
Mm-hmm. I mean, I think like, so every school program's different. So if you have any ability to kind of like find your own clinical placement or to advocate for yourself to have placements in the area you're interested in, that's always helpful. Mm-hmm. If you like can work as a nurse in that field while you're like going back to school, that can be helpful, or even like finding clinics or like shelters to volunteer at as a medical provider where you're doing things specifically for women's health. Mm-hmm. Like going to different trainings when you're in school. Like I remember I did one on like miscarriage management when I was in school, just because it's like, if you can do different trainings that are adding to your knowledge in your field, like all of those things, it's like at the end of the day, you're still a newbie, right? And if they want somebody with experience, they want somebody with experience. But if it's you and somebody else and you have those things, I feel like that gives you a heads up.
Absolutely. So Madison wants to know, is it as hard to get a job in women's health or a certified nurse practitioner as everyone makes it, or sorry, certified nurse midwife, as everyone makes it out to be? And you've kind of touched on that, but.
Yeah. I mean, so I did family practice. And so I think you can kind of like make your own like niche in that. It's definitely like a lot of people want to do women's health. So like any specialty, there's less of a need for it than family, right? So you're automatically going to have less jobs because it's a specialty. So there's like a lower need for it. Like when we're looking at our overall health, like women's health is like a portion of it. I really don't know anything about like nurse midwives as far as like getting jobs, but I do know like my friends that have like women's health or like peds have a harder time getting a job than I do. But I also am like more flexible and do like family. So.
And I think that's the case when you're trying to get experience, whether you're fresh out of nursing school in a really saturated area. If your end goal is NICU and there's no NICU jobs because like you're saying it's so specialized, just go for what you can get and then move forward. And when you've had the experience they're looking for, you can hop into that field. That's what I love about going with a broad-based Fnp and specializing. That's such great advice. So we're going to talk about real world experience now. What kind of hours do you work? I don't remember who submitted this question, but somebody.
So I started my own business. So it's an online business. So when like COVID hit, I was kind of laid off, kind of decided to quit because I had been wanting to kind of like shift. I had started working with a business coach on my own business. So that's completely new and different. So I guess I won't really speak to that because that's just like the time I choose to put in. And I'm just started doing that. Really, like I got my LLC, I think in July. Before that, I am a strong advocate for not working more than 32 hours a week if you can. I really think there's something to that, like kind of like largely speaking in the like women care providers are really high risk for burnout, for depression, for like taking on a lot of our patient weight. And so if you can find job balance in that and financially that works for you, I would say that. I think in the like, 7 years that I worked as an NP, I worked 40 hours 2 of those years. And it was my first year. I don't even think I made it a full year before I cut back. And then I did it like a year and a half ago. But I worked like a heavy percentage of what I did. So I did like a direct primary care or like concierge medicine, but it was for like coordinated care patients and people that had like private insurance. So coordinated care is like Medicare, Medicaid, like we kind of had like Medicare, Medicaid, private. And then I did like a huge portion in a community health clinic and did like school-based health clinics and a homeless youth clinic there. And then worked for Amazon for like a year for their like medical startup and then went back to like community health and school-based health clinics. So I'm going to like largely speak to what it's like to do community health. So I would say, those clinics are like rapid fires, like 15-minute visits. You're like booked all day long. I would say like when I worked 32 out, like paid 32 hours, I think it was like 80-20 split. So 80% of that was like in the office and then you get 20% for like chart review or whatever, which is pretty common across the board, like an 80-20 as a nurse practitioner, like 80% patient facing. And then 20% is like doing your labs, your chart reviews, like signing papers, like whatever. And I would say I, on average, worked like 50 to 60 hours a week, like total, but was paid for 32. I feel like that's pretty consistent.
Wow.
So it's a lot. It's a lot of work. And I think it's like, that's why family practice can be challenging and not as like sustainable long term from an NP perspective because of the pay. Versus my friends that work specialty, you tend to get paid more. And often you're like doing the same complaints over and over. So like charting can be a little bit easier. It just depends on like the practice you're set up in. But like family practice, you're working a lot of hours. You're usually not paid the best, though I did have pretty good salary, I feel like, at some of my jobs. But you're definitely like underpaid for the hours you work, like across the board.
Okay. That's unfortunate. So I think it was Hannah asked, do you have life outside of work? And I guess you can speak again to your previous experience, and then you're welcome to share like your balance that you're finding now as an entrepreneur in the nursing field.
Yeah. I always feel like that's really important to me. Like work-life balance is hugely important to me. I also think like, as a nurse and as a provider, my coworkers were like close friends of mine. So not only like in the office, but outside of the office, which I think kind of helps you feel like you have a work-life balance, even if you're at work. But I always like made time, even though I'm saying I worked like 50 hours a week, like I would like go do things after work and hang out and then would like go home and chart, or I would like chart at a brewery. Like, I don't care. Like I would have like privacy screen on my computer and would just like chart at a brewery. I think that's really important. Like entrepreneur wise, I feel like that is something that really scared me. Like I wanted to do it because I don't like how our healthcare system's set up. I feel like 15-minute visits, like who has time to actually like address their health and well-being in that? Like you're rapid fire, like addressing problems, never really getting to the root of anything. And I think it's like, nursing to me always feels kind of like we have that like social work base, right? Like you want to know like what's going on with people and their family and like what stressors they have, what their lifestyle's like, because that is how you make changes. And so I think, yeah, like it's interesting, but because of that, I chose to not do anything insurance related. And I'm kind of more doing of like my business is more education focused and like mindset and incorporating like mind, body, lifestyle stuff. But it's challenging. Like you don't really get business education in nursing or in grad school. And so it's been like me trying to figure out all of those things by myself. But I'm passionate about it. So I spend a lot of time like doing business things, but I don't mind because it's just like enjoyable. And I'm like at home and my boyfriend is at home. So we both are like working from home, and as much as you can like be social in COVID, like it feels like a good balance to me for sure. And like once my business takes off, I feel like I'm going to be so much more happy because even if I am doing a lot of hours, it's like only the things I'm passionate about versus like in, like family practice or whatever, or even if I was just doing women's health, like there's still things that like, I don't love geriatrics. Like that's like late menopause. That's not really something I like super love doing. So it's also nice because you can kind of like more hone in on what you enjoy.
Yeah, that's really true. And I can speak as an entrepreneur myself. It's hard to balance that once you dive in and your business starts rolling and all of a sudden you're like, I could work 24/7, literally. And you have to have those strict, like, no, it's dinner time. You have to put it away and don't look at it again until 8 a.m. or whatever that is. Yeah, it's interesting. But I'm really glad that you're super passionate about the path you're taking, and that's super exciting for you. Because again, nursing is endless opportunities. So Brandy asked, how much autonomy do you have in your practice? And again, I guess we can talk more about your previous experience and then currently how much autonomy you have, because you have all the autonomy.
Yeah, like right now I basically do whatever I want. And I would say like it really just depends on like what state you live in. So I was in Washington for the last decade, and Washington, like I came from New Mexico. Washington's similar, Oregon's similar, and all of them you have full practice authority. So I can have my own practice, even when I was like working, like when I was working in Washington, like I had a team of people, but it's not like certain states like California, you have to work under a doctor.
Mm-hmm.
You have to have a doctorate in your practice. So, yeah, I would say like be mindful of that and what that's going to feel like if you choose to go back to school based on like where you're living. But I always like managed my own panel. Like I had all of my own patients. I was like the one like diagnosing, doing the labs, doing the meds, doing the follow-up. So you have, it also kind of depends. I would say like, that isn't like in a family practice, like community health setting. And they really push nurse practitioners to be autonomous because we save them money. We have better overall health outcomes when you look at the studies compared to other providers, which is cool. But there are some settings. So like my friends that do specialty stuff, like I have one that works at like Seattle Children's and another one that works in like neurology. And so some of those, they have like more specified roles that you're doing, and you are kind of more like siloed to certain areas of like, you do these follow-ups or you do these things and the doctors do these things. So I think it also just kind of depends on what area you work in. But yeah, that was also like the autonomy was one of the main reasons I went back. Cause I remember like, especially working in PICU, I would get like so frustrated with like, not really like me feeling like we're looking at like a full picture and like taking in like a family situation into account. Mm-hmm. And just thinking that I would do things different if I was in charge. And so to me, it was really important to work in a state that was autonomous, like that I could like have full practice authority.
And I think that speaks to having some well-rounded prior experience before going back for your master's, just because then you really know what you want and what you don't want. And I don't feel like with very minimal experience, you can really have that authority over your future choices.
Yeah, I think it's interesting. Like I see like the pluses and minuses of both sides, because I think I have like a couple friends that didn't have a degree beforehand, and it's like I am forever grateful that I did that. And I feel like it really added to me being like really clear on like what kind of provider I wanted to be, because I had seen a bunch of different other providers. And so it's like I had all this modeling, and then I got to be like, okay, like how do I want to show up? Which you can learn in like clinicals and stuff. But I think it's like when you've been in practice, you understand those things more. And I think also just like a general comfort in a medical situation. I feel like that for me was like really big. I didn't really expect there to be such a huge like mind shift change from being a nurse to being a provider. And that was really massive. And I didn't expect it. And so like my friends that never really had to show up as a nurse, I think that was like in their benefit, because they didn't understand like what it was like. And I've talked to my friends that have been nurses and then go back, and we're like, it's literally so different. Like it's so different. So I think there's like pluses and minuses, but
sure.
Yeah.
I experienced that not on a provider level, but from a CNA to a nurse, that mind shift is very different. And so I can see how going from nurse to provider would be very different as well. Mm-hmm. So Courtney asked, what kind of legal obstacles are you seeing in the area of women's health, particularly things like reproductive rights and women's ability to receive care based on laws we have in place? Do you have anything to say about that?
Yeah, I mean, I don't really think, so I have like a tickle in my throat. I feel like it gets talked about a lot. It's really important that we like stand behind like the voting and what we think is important. And, I think like with elections and everything coming up, it's like a huge concern. Again, I've like largely worked in Washington. And so, there are restrictions in the laws, which makes it challenging. Like, for example, there was only like certain clinics where women could get abortions in Seattle, but it's like definitely you could get them, but it just was like not in a family practice setting. So I think it's like we're creating barriers, or it's like people had to go to like Planned Parenthood, or there was like certain like OB-GYN clinics. So like definitely there are some barriers, but Legally, Washington, which is really the only state I know as like a nurse practitioner, there's very, very, very little like issue as far as like having full reproductive access. But it's definitely different state by state. And I think that's challenging, and like where votes matter, and also something to consider when you're practicing. And if you have a vote that counts in states where we are more restrictive, I think like really important to voice that. Yeah.
Okay. So now we get to dive deeper into your business. I would love for you to share with us specifically what your business is and why specifically you got started on this journey.
Yeah. So like I said, my business is, so it's like all online right now. Like at some point I would like that to change. But I really just empower women to kind of fully embrace their cycles and their power as women. So that can look like a lot of things. So I do fertility awareness education. So the symptothermal method, which I feel like a lot of people, like I was definitely not taught it in nursing school or really as a medical provider of like how to use it, how to teach it. And it's like super effective, like based on studies. So I teach that. And then I also, like I said, do holistic health coaching. So I'm doing a course now in functional medicine, which really, I would say like anybody that's interested in holistic health should look into that. But it's really based on like the root causes. So we have all these diseases and symptoms, and often you can kind of like boil down where things are coming from, based on working with patients on like lifestyle and health. And you still can integrate Western medicine into that, but it's looking more at like the larger picture as opposed to just like treating a disease at a time and trying to silo our life and our exposures and our trauma and our family history, like all from each other, because they're all connected. And all of that is like affects our health. So I'm, integrate like functional medicine principles and also holistic health, a lot of like lifestyle mindset coaching. I have my yoga certificate, so I do a lot of like movement and breath work, like mudras, mantras, a lot of kind of like the spiritual components that like work into our energetics. So it's kind of unique and like different in that way. But I really think like women are starved for like self-esteem and self-worth. And a lot of us have like poor education about our bodies from a young age. And a lot of us, even like medical providers, like I don't know how many like nurses and providers I've talked to where I'm like talking about, something with like fertility or with hormones or our bodies that are like, oh, I didn't know that. And so really like, to me, it's so important that we really understand our bodies, because I think understanding our bodies allows us to really have more of an ease in our daily life and to experience that with like more kindness and more curiosity, rather than feeling like something's always wrong with us. Because I think that's definitely like Western messaging is like, you have all these diseases and all of these things are wrong and you need to pill for everything. Like half of women over like 50 are on like an antidepressant and like a cholesterol medication. And I just feel like it's time that we change that by like actually looking at a full picture of a woman.
Wow, that's really crazy statistics. So when you're working with your clients, or what do you like to call them?
Yeah, I would say like I kind of lean more towards clients now, just
okay.
Because.
So when you're working with your clients and say you and I are working together and you feel like there's something that, maybe I should get my hormones evaluated or something like that, can you, since you're in a different seat than I am, can you order labs to be drawn?
Yeah, so how I have it set up right now, and I may end up changing it next year, but it was like, it's so much to figure out, like ordering labs. And then when you're a nurse practitioner, like your license is different state by state. And so telehealth laws have like kind of gotten a little more lax in the last, year with like COVID, but there's still telehealth laws. And so it makes it really challenging. And then kind of depending on like who you talk to, like I talk to so many like attorneys and providers, then it's a lot easier for, you know, for like medical doctors, like MDs to do this because you can see somebody anywhere. But really as like an NP, you're pretty, if you're a conservative legal person, which I tend to be, you're pretty restricted as far as what you can do. And so I kind of take on more of like a educational consult view of like, you have your own provider and that provider you keep, like I'm not anybody's primary care provider. And so instead do more kind of like looking at overall picture and doing like mindset health coaching. And then we can go through like medical chart records or like fertility charts and look at those things. And then instead I would say like, you know, I think it could be beneficial for you to get these things checked. There are like some tests that patients can get done online with like, you know, that they can just like go in and order without a provider. And if not, then like having their regular provider order them and then we review them together. But like really kind of, I think of myself more as like an adjunct to like be part of their overall team and to help them advocate for their health when like you're in a 15-minute visit, you don't really have time to do these things with your provider. So I don't order labs, but I definitely like would review them or like suggest to people what I think would be helpful for them to have checked.
Okay, good. So I was actually looking at your Facebook page and I saw that you were talking about the hormone-free birth control and that you provide support and education for women regarding that. And I find that really interesting because birth control, hormonal birth control was not my friend. And I think that that's very common for so many women that they don't realize that their moon fluctuations and all these different things are really attributed to the hormonal birth control that they're on. And so I love that you're providing this sort of education. If other people are interested in contacting you and talking to you about your services, is there one line of communication that you prefer that they use? I'll include everything in the notes. Every way to contact Mona is all there. But do you have preference?
Yeah, I really don't. Like whatever is easier. Like I know not everybody, I get kind of the comment a lot if I'm putting stuff on Instagram, like, well, but I'm not on Facebook. Like I have a private women's only group there. But any message, like I would say like if it's like specific questions or like whether it's about like my services or like wanting to connect, like email is probably better. Just because if we're going to have like a dialogue or trying to set something up, I would need your email anyways. But if you just want to like follow and connect, then using like any of my social media. And then my website does have like a link if you're actually interested in services and want to like set up a visit to like talk about potentially working together. There's like a link to set up a free 15-minute call where we kind of like talk through what you're wanting. That's on my website.
Okay, perfect. Well, I really appreciate the time that you've given us today and the education that you provided. The group here is really about empowering nurses and students through this community and laughing together and learning together and supporting one another. So I appreciate you giving to us and supporting us in that way. So thank you for being our guest and never stop learning, tribe. Have a great day. Thank you, Mona.
Thanks.